Good afternoon, everyone, and welcome to the March edition of the Benefits Lunch Break series. Happy to have everyone who joined on the line. I'm going to give you a disclaimer here up front. Hopefully I sound all right. I might be a little bit hoarse. I did test positive for COVID recently. So as you'll see, the topic of our webinar is the ending of the emergency declarations related to COVID. And I guess ironically tested for COVID. For those of you that have attended these seminars in the past, you know we do this monthly. And it's on the third Wednesday of every month at noon Eastern time. On the slides here, you can see the schedule for the rest of 2023. At this point, we don't have a full year of subjects or at least topics lined up. So if you have upcoming topics, feel free to present them through the Q&A feature or the post-webinar survey. As you guys, as advertised, we're going to be talking about the end of the emergency declarations with respect to COVID and what implications that has on group health plans. Just another thing to make you aware of, we issued a client alert on the same subject today. That is accessible on our website. I believe my colleague is going to put that in the chat feature. We'll also include a link to that client alert in the follow-up email that comes after this webinar that includes the recording link. Also, finally, last housekeeping item, you can certainly submit questions in the chat or in the question and answer feature, and I will try to address those as time permits. I may try to address them as I'm presenting, but since I'm doing it by myself, it's a little bit hard to kind of monitor the question and answer column and present at the same time. So I may wait till the end to address some of those questions. With that said, let's get started. So today we are going to take you through kind of a background on the COVID-19 protections applicable to group health plans and how those are tied to the emergency declarations related to COVID-19. And there's actually two emergency declarations related to COVID-19, and you have different implications that are applicable to group health plans that are tied to each. And actually you have some that are tied to none. So that can be confusing. We'll talk about what the end of those mean for group health plans, next steps that you should be thinking about. And then again, if time permitting, we will have questions. So again, beginning with a little bit of background, if you think back a little over 3 years ago, January 31, the Department of Health and Human Services, or the Secretary of HHS, declared a public health emergency to COVID-19. These public health emergencies declared by HHS only last for a period of 90 days, but can be renewed indefinitely. And the public health emergency, or PHE, was last renewed by HHS on January 11, 2023. So without an early termination, it would last 90 days from that. Similarly, on March 13, 2020, President Trump declared a national emergency under the Robert T. Stafford Disaster Relief and Emergency Assistance Act that was actually effective retroactive back to March 1, 2020. These presidential national emergency declarations must be renewed annually. So they generally last for 1 year from the effective date, unless they are renewed. Again, it was last renewed by President Biden on February 10, 2023. So would have lasted till February 10 of 2024, unless it was terminated by the administration early. Before moving on, I do want to point out one thing that I did unfortunately forget to include in my presentation, but I will address that here. At the very early onset of COVID, when people couldn't work or people were needing additional paid time off, I had a lot of clients ask me about what we referred to as leave sharing arrangements. And these leave sharing arrangements, if set up properly, you can have employees who donate their unused leave or paid time off. However, that term is very broad. So PTO, leave, vacation, whatever, it's all included, to other employees who may have exhausted their leave but need it. And again, if these are set up properly, the donor of the paid time off can donate it on a tax-free basis, and the recipient claims the wages, income, and payroll tax obligations on the donated leave. Those leave sharing arrangements are always permissible for medical emergencies, but they are also permissible on a tax-free basis when certain emergencies are declared under the Robert T. Stafford Act. And so the president's declaration of the emergency under the Robert T. Stafford Act basically opened up what we call these emergency leave sharing declarations, which could be provided on a tax-free basis. When this national declaration expires, which we'll talk about here in a minute, you can no longer allow those leave sharing arrangements, at least on a pre-tax basis or a tax advantage basis to the donor, outside of the medical context. Again, medical emergency leave share policies are always permissible. Again, I apologize for not putting that in the presentation, but I did want to note on that. That's one thing that I just thought of this morning. Jeff, next slide, please. So the PHE declared by Health and Human Services and the national, as I mentioned, the public health emergency declared by HHS and the national emergency declared by the president drive the different COVID-19 related protections that apply to group health plans. So first of all, I think probably, top on everybody's mind, and we had all these extensions to various deadlines that apply under group health plans. There were actually deadlines that were extended under retirement plans too, but those are largely gone, and I won't be addressing those. So again, those were generally deadlines related to COBRA, HIPAA special notice, or HIPAA special enrollment opportunities, and claims and appeals. And that is actually tied, well, those deadlines had to be extended during what we call the outbreak period, which we'll cover in a few slides, and were tied to the national emergency declaration. There were a lot of other coverage mandates, COVID-19 testing, the coverage of COVID-19 vaccinations, that are not tied to the president's national emergency declaration, but instead tied to HHS's public health emergency declaration. And then, of course, there were some implications on group health plans that aren't tied to either, and therefore won't really be expiring. And we'll talk about that again. So again, as I mentioned earlier, it is a little confusing to keep track of. I'm going to take a break right here before I go on, just check to see if we have any questions, which we don't. So on June 30, 2023, the Biden administration announced its intent to end both the public health emergency declared by HHS and the presidentially nationally declared emergency on May 11, 2023. Again, it's intent. So I suppose there could be things that would occur between now and May 11 in 2023 that they change course of action, and that these emergency declarations don't actually end. We haven't heard anything to that regard, so I fully expect them to end on May 11, 2023. But just keep in mind, it is not written in stone. I think we did get a question. So question, I think that we'll be able to print these slides for future reference. I think that they are included in the follow-up email, and you can get that. If not, feel free to reach out to us, and we can get you a copy of the slides for future reference. Absolutely. So let's talk about the relief that's tied to the president's national emergency declaration. Again, these are those extensions of deadlines. Under Section 518 of ERISA, the Department of Labor is able to basically disregard for a period of up to 1 year certain actions that are either permitted or required to be taken under employee benefit plans that are subject to ERISA, which would include most group health plans. So these extensions did not necessarily apply to group health plans sponsored by non-federal governmental employers or church plans, but HHS encouraged plans, at least federal plans sponsored by non-federal governmental employers, to adopt the same relief. So at EBSA Disaster Relief Notice 2020-01, the DOL exercised this authority to disregard time periods for the following deadlines related to group health plans. And it's the ability for a qualified beneficiary to elect COBRA continuation coverage, to pay premiums for COBRA continuation coverage, which caused a lot of administrative uncertainty for group health plans and how they were going to administer that for people who just didn't pay for a significantly long period of time. To elect enrollment following a HIPAA special enrollment event, those are generally new additions of new dependent by either birth, marriage, adoption, placement for adoption, loss of other group coverage that wasn't voluntary or done because of lack of payment, and then certain changes with respect to Medicaid and what we call CHIP eligibility. To file claim for extended the deadlines for participants to file claims, appeals, and requests for internal reviews. And then the last item there is actually an extension that applied to plan sponsors. And that was generally following a COBRA qualifying event. You generally have 14 days for the employer to provide the plan administrator with a notice of the COBRA qualifying event. And then the plan administrator has 30 days to provide a participant with the COBRA election notice. Now, in most situations, the employer is both the employer that sponsors the plan and the plan administrator. So they generally have 44 days once they're notified of a COBRA qualifying event to get that COBRA election notice out. The DOL in EBSA Disaster Relief Notice 2020-01 extended that 14-day period, not the 30-day period. But if you think about in most situations where employer sits in both roles, the extension of the 14-day period is somewhat by nature automatically going to extend the 30-day period in which to get the COBRA election notice out. Now, most of my clients, anecdotally, I think, still tried to get these COBRA election notices out on a timely basis, trying to encourage people who wanted COBRA to elect it as quickly as possible, even though they had significantly more time to do so if they wanted to. Certainly, these deadlines increase the risk for adverse selection, because you very much extended to a year and 60 days. Hey, I'm not going to elect COBRA until I'm diagnosed with some medical condition, and now suddenly I need health insurance. Again, so these will be going away, and I think much to the relief of a lot of plan sponsors who have struggled with this. So again, these deadlines were extended or tolled during the outbreak period, which was effective May 1, 2020, and ends on the date that's 60 days after the date that the presidentially declared national emergency under the Stafford Act ends. So keep in mind that the outbreak period is not going to end on May 11, 2023. It's going to end 60 days later on July 10, 2023. So please keep that in mind, because again, that's slightly different from how it's going to operate with the ending of the public health emergency. In 2021, when we were coming right up onto about a year of these extensions, we really wondered what the DOL was going to do, because they didn't have the statutory authority to disregard these periods for more than a year. And at the 11th hour, the DOL provided additional guidance in EBSA Disaster Relief Notice 2021-1 that it was tolling these periods on an individual by individual deadline basis, which, again, where that was a benefit for participants in plans, was probably the most administratively burdensome way they could apply that guidance for plan sponsors. So by way of example, I have a 30-day grace period to make every single one of my COBRA premium payments. So the DOL would take the position, if my grace period ended on March 31 for one grace period and then April 30 for the next grace period, each one of those would be extended for a year, rather than just kind of one blanket extension that applied to all. So again, that created a lot of unease with plan sponsors and how they were going to administer that correctly from an administrative standpoint. So here, an example of the extension, how the extension works. Assume a qualified beneficiary experiences a COBRA qualifying event because they terminate employment with their plan, and that causes them to lose coverage. And this happens on March 1, 2023. Well, in the ordinary pre-COVID world, the qualified beneficiary would have to elect COBRA generally by April 30 of 2023. And if they fail to do that, they would no longer be eligible to elect COBRA. However, under the DOL's extension or tolling of these deadlines during this outbreak period, the qualified beneficiary potentially had up until 1 year from that 60-day deadline, or April 30, 2024. But now that we know the end of the outbreak period is going to be July 10, 2023, so basically on July 11, we unpause counting those 60 days, we count 60 days, And now the participant, or the qualified beneficiary has until September 8th of 2023 to elect COBRA, and that election will still be timely. So again, the important part here to remember is we have the end of the presidentially nationally declared emergency on May 11. The outbreak period doesn't end till July 10. And then we just have to start counting the days in the deadline. So again, the 60-day deadline that they originally had to elect COBRA is going to bring them out past July 10, all the way until September 8, 2023. So I assume that most plan sponsors that are involved in this are somewhat excited that these extensions are going away. But keep in mind, there's a lot of areas for foot faults as we kind of unravel these rules. So again, I got a little bit ahead of myself on the last slide. Again, explaining that the outbreak period will not end until July 10. It's not going to end on May 11. And then we have to basically unpause the counting of all these deadlines and therefore calculate it from July 11 of 2023, because July 10 is the last day of the outbreak period. HHS's public emergency declaration. So COVID-19 testing. So the Family First Coronavirus and Relief Act required both grandfathered and non-grandfathered group health plans to cover certain items and services related to COVID-19 testing within certain requirements. And this was expanded on by the Coronavirus Aid, Relief, and Economic Security Act, or what's more formally known as the CARES Act. So these testing and services had to be covered without participant cost sharing, so deductibles, co-payments, co-insurance, without pre-authorization requirements or medical management techniques, were also had to be covered on an out-of-network basis. And if there was no negotiated rate between the plan and the provider, out-of-network provider, it would have to be paid at the provider's published rate for the test. And the CARES Act required providers to publicly post those tests. I know that didn't always happen. And as we kind of saw this unfold, we saw the requirement for group health plans to cover certain different tests expand, not contract. And so in fact, we've got some guidance from the departments. And when I say departments, I mean Labor, Health and Human Services, and Treasury all together, that said, hey, we got to cover tests maybe that aren't even ordered by a medical professional. So for example, I'm going to go visit a family member, and maybe that family member is elderly, and out of the abundance of caution, even though I don't have any symptoms, I want to take a preventive test. Those had to be covered. And then even at the beginning of 2022, we saw this expansion that at least eight out of at-home tests per month had to be covered for each participant. So if you had a family of four, a health plan was potentially covering up to 32 tests per month. My suspicion is after the public health emergency ends, and we'll talk about what that means, and employers have more flexibility in how to cover testing with respect to COVID-19, I suspect many will probably still cover COVID-19 testing and related services, without cost sharing. Maybe there will be prior authorization, such as they'll only cover it with no participant cost sharing if it's ordered by a medical provider. I think you'll see group health plans abandon the requirement to cover at-home tests, not because they're necessarily opposed to that, but it was just really muddy in how to cover those and how our participants were going to be reimbursed. I also suspect most will probably be stopped covering it on an out-of-network basis, but that remains to be seen. So one kind of just similar comment, but it's a little bit off track here. When we had this requirement to cover these testing and items and services without participant cost sharing and before the deductible, sponsors of high deductible health plans said, well, how is this going to impact my high deductible health plan if I'm covering these services before individuals satisfy the high deductible health plan? Is it no longer going to be a high deductible health plan? And if that's the case, then all of my participants in that high deductible health plan are no longer going to be HSA eligible. Well, in the IRS issued notice 2020-15 to address that. And in that notice, the IRS indicated that it's permissible for health plans to cover COVID-19 testing and treatment before the satisfaction of the deductible, without jeopardizing the plan's qualified high deductible health plan status, and therefore jeopardizing participants in that plan's HHS status. It's important to note that this relief does not expire on May 11, 2023, with the ending of the public health emergency declared by HHS. Rather, in Notice 2020-15, the IRS indicated that this relief will continue to apply until further guidance is issued. So where employers still may have some flexibility beginning May 12, 2023, in how they cover testing and other treatment, if they want to cover that pre-deductible under a high deductible health plan, that appears still to be permissible, but we do expect further guidance from the IRS, and we want to watch out for that, especially if they remove this relief offered by IRS Notice 2020-15. And I apologize, there should be a correction on the slide. So that should say on May 12, 2023, the day after the public health emergency ends. So I really apologize for that. That should, I'm confusing myself with the end of the outbreak period. So on May 12, 2023, the day after the public health emergency ends, group health plans will have flexibility in determining how to cover items and services related to at-home COVID testing. So again, as I mentioned, no requirement to cover out-of-network services that are at-home tests. And I suspect a lot of plans, whether they do that immediately or upon renewal, and we'll talk about why that may be an important distinction, won't require that. Can impose pre-authorization or other medical management. So you could say, hey, we're only going to cover tests that are dictated by an order from a provider. We're not going to do this, hey, preemptive, I want to go visit my grandmother, so I'm going to take a preemptive test and submit that for coverage. You could potentially exclude coverage too. That is also permissible. Again, I don't think that I'll see many plans go that way because there's obviously some value in detecting COVID early. And as mentioned on the previous slide, IRS Notice 2020-15 is not tied to the public health emergency. So high deductible health plans can continue to cover COVID-19 testing before the satisfaction of middle deductible without jeopardizing anybody's HSA eligibility. But again, we want to watch for future IRS guidance on this issue, again, especially if it's removed. Shifting gears a little bit to COVID-19 vaccines, and this is really going to be more applicable to non-grandfathered group health plans, because the requirement under the FFCRA and CARES Act to cover COVID vaccines was actually kind of pigeonholed in the ACA's requirement to cover preventive services, which, as many of you probably know, grandfathered group health plans are not required to cover preventive services under the ACA on a first dollar with no participant cost sharing. So again, this is going to have a lot. So really, I mean, grandfathered group health plans didn't have to cover COVID-19 vaccines historically, or could actually cover them and subject them to participant cost sharing. I think most probably opted not to do that, but that was permissible. So, what's important is that the requirement for non-grandfathered group health plans to cover COVID-19 vaccines is not tied to PHE. So on May 12, 2023, they will still, non-grandfathered group health plans will still have to cover COVID-19 vaccines without any participant cost sharing. Also, for new preventive items and services that are added that get the recommended government approval, and that's basically a rating of A or B by the U.S. Preventative Services Task Force, or a recommendation by the American Community of Immunization Practices. I don't know all these acronyms, or a preventive service by the HRSA. Once it gets kind of the stamp for approval, if it's a new service, a non-grandfathered group health plan doesn't have to start covering that service on a first dollar basis until the first day of the plan year that begins 1 year on or after the date that the new item or service began that recommendation. But with respect to new COVID-19 related preventive items and services, those need to be covered with no participant cost sharing within 15 business days of receiving the required recommendation. It'll be interesting to see how many new services end up on the market and get these recommendations. The last one was was in August of 2022, and I believe that was the Novavax virus. And again, this requirement is not tied to the PHE. So again, here is another misprint on the slides that should be getting May 12, 2023. Maybe if we send these slides out in a link, hopefully they can be corrected before they are sent out. Non-grandfathered group health plans must continue to cover COVID-19 vaccines on a first dollar basis. When obtained by an in-network provider, you don't have to cover them on an out-of-network basis anymore if you don't want, or if you do, you can certainly impose participant cost sharing. And you got to keep your wits about you for when new items or preventative items, services related to COVID-19, including vaccines, are issued. They may have to be covered within 15 days. Grandfathered group health plans have much more flexibility in how or if they'll cover COVID-19s, as they have been in the past. They will continue to be able to cover them without participant cost sharing, but they certainly can impose participant cost sharing. IRS Notice 2020-15 should still apply to group health plans that voluntarily cover COVID-19 vaccines on a first dollar basis. And frankly, since these are preventive services under the ACA, like any other preventive service under the ACA, a high deductible health plan can cover preventive services pre-deductible without jeopardizing HSA eligibility. I'm going to pause here before I move it on. I see a couple questions. I'll try to address those here. How does presidential order ending in May affect state laws in place for COVID-19? I'm not sure I have a great answer to that question. It's pretty broad. And I'm not sure that it will have any direct effect. Again, and I'm not sure necessarily what state laws we're talking about here, but when we're talking about ERISA covered health plans, certainly self-funded health plans, a lot of state laws are preempted still under HIPAA, and nothing was set aside by that, by the presidential vaccination. Moving on, another question. So beginning on September 9, 2023, the 61st day, and this goes back to my example, following the end of all normal deadlines for COBRA election, COBRA premium payment and HIPAA special rules apply again. Well, keep in mind that the HIPAA special enrollment rules are going to apply. Yeah, so basically on July 12, 2023, you are going to unpause and you can start counting, whether it be a 30-day deadline or a 60-day deadline. You're going to start counting those deadlines that were paused beginning from July 12. So in my example, I had a full 60-day COBRA election requirement that was on pause. It unpaused, so we measure that 60-day period from July 12th. If it was a HIPAA special enrollment event that only had 30 days, you would measure 30 days from July 12th. So does that mean vaccinations will no longer be covered after May 11th? Absolutely not. I mean, again, first of all, non-grandfathered group health plans, which is the vast majority of health plans, will still have to cover vaccines with no participant cost sharing, or what I refer to as on a first dollar basis, even after the public health emergency. And that's a requirement that was modified by the CARES Act. Non-grandfathered group health plans, which again is a very, very minority of the amount of group health plans, they can arguably not cover them, or they can impose participant cost sharing on vaccines. It'll be up to the plan sponsor what they decide to do. But certainly that does not mean that the ending of the public health emergency is going to end just all coverage of vaccines. Are we required to notify employees of these changes? I'm going to address that in a few slides, because that really depends on what your current documents say and what document we're talking about. So again, I will cover that in a few slides. So high deductible health plans and telemedicine. So the ending of the public health emergency and the presidentially declared national emergency will not impact the relief that allows high deductible health plans to cover telemedicine before the satisfaction of the medical deductible for high deductible health plans without jeopardizing employees' HSA eligibility. We have issued some clients alerts on this. So for some of you that's been paying close attention, you'll remember back under the CARES Act, basically plan years that began before January 1, 2022 could cover telemedicine benefits, prior to the satisfaction of the minimum deductible for high deductible health plans without jeopardizing an individual's HSA eligibility. Again, that expired virtually for any plan year that began on or after January 1, 2022. It was extended kind of mid-year, effective as of April 1, 2022, but only through December 31 of 2022 by the Consolidated Appropriations Act. So they extended that guidance, but we had this weird gap period of January, February, and March where it couldn't be covered. And it was most recently extended again in the Consolidated Appropriations Act 2023 for plan years that begin on or after January 1, 2023, and before January 1, and before January 1, 2025. So Congress is kind of ping-pong the ball around here about when high deductible health plans could cover telemedicine benefits pre-deductible without jeopardizing HSA eligibility. Keep in mind, and I'm not going to go through this because it's a little bit complicated, but if you have a non-calendar year plan year, the way that this guidance intersects is you may have some little period of time in 2023 where you technically can't cover telemedicine benefits pre-deductible without jeopardizing HSA eligibility status. If you're a calendar year health plan, you've kind of snaked through this, but I think this was overlooked when the statute was written. So next steps, and really this is item number one here is a response to the question that we got. You should review your plan documents and summary plan descriptions to see if any changes in your plan design are going to necessitate any changes to those SPDs. So if you're going to remove, COVID testing from being covered on a first dollar basis in all situations, and your SPDs state that it's going to be covered, we probably have to issue a summary of material modification within 60 days of that change be taking effect. Probably more importantly is review your summary of benefits and coverage, or SPC. Remember, any mid-year changes to an SPC triggers a new SPC to be provided at least 60 days in advance of the effective date. This is why I think, if your SPC addresses how the plan covers COVID-19 testing, or addresses how it covers vaccinations, and your grandfathered plan able to change how it's going to cover vaccinations, you may kind of want to unroll this consistent with your next plan year so that those changes can be made in your next annual SPZ distribution rather than having to do this mid-year advanced distribution. You should work with your TPAs if you're a self-funded plan, your insurers if you're a fully insured plan, and other service vendors, such as I think particularly COBRA vendors, to make sure that they've got their antennas up and they're aware that these are ending and the issues that's going to present. And then finally, again, watch for future guidance. We expect both the IRS and the Department of Labor, probably HHS too, to issue additional guidance on how the conclusion or the ending of these emergency declarations will impact group health plans. And with respect to some of the notice requirements, particularly deadlines like the SBC, maybe like going into COVID, we see some relief there, but that all remains to be seen. And of course, we'll stay on top of that. We'll do additional webinars in the future as necessary, and we'll certainly continue to do client alert. So if you're not on our client alert distribution list, please let us know and we can get you signed up for that. I'll give a few minutes here to see if we have any other questions roll in. I think we don't at this point. But again, I want to thank everybody for joining us today. And hopefully you will join us next month in April for our next edition of the Employee Benefit Lunch Break Series.